We've been getting calls and emails from many of you who were surprised to hear about large outbreaks at loved ones' nursing homes. We've been working for weeks to list all of the facilities with cases, but Virginia and Maryland aren't releasing those names, which begs the question, if the lists aren't publicly reported, how will loved ones know if cases are being hidden from them? Virginia's Department of Health releases a daily report with the number of COVID-19 outbreaks statewide. Right now, there are 80 at long-term care facilities with 939 cases and 77 deaths. The state posts individual pie charts showing how many outbreak facilities are within each health district. Fairfax leads the state with 24, followed by Loudoun with 7. We know Northern Virginia nursing homes, assisted living, and care centers account for at least 40 outbreaks. Fewer than half have been disclosed publicly. The News 4i team filed a Freedom of Information request asking for all of those names, but the state rejected it, interpreting a facility as a person, thus exempting the names per statute.
As a community, I think we really need to know more information so that we have a full understanding of what our community is facing. We make good decisions.
Elizabeth Brokamp says when she last heard from staff at Green Springs Senior Living in Fairfax County, only one resident and a few staff were sick. Then she says she got a call last week that her 95-year-old father, William Rouse, wasn't doing well. He died 2 days later from COVID-19.
There's the really personal side, which is if you know what to expect or at least know what your loved one is facing, then maybe you can help. Maybe you can reach out one last time.
Washington, D.C. leaders have been the most transparent, last week naming 11 long-term care facilities with more than 100 total positive cases and 9 deaths. Maryland's governor was initially vocal, disclosing that 90 long-term care facilities were suffering outbreaks, but that was on April 5th. The state has not released a list of facilities or even any comprehensive numbers since then. Some individual homes have shared information, particularly those like Pleasant View Nursing Home in Carroll County, where 24 residents had died as of a week ago. Here's where you can help. If you have a loved one in a long-term care facility in D.C., Maryland, or Virginia, and you've been getting firsthand information about positive tests or deaths from COVID-19, email tips@news4iteam.com and help us fill in those gaps. We'll be working to confirm and post that updated information online and in our NBC Washington app. Jody Fleischer, News 4i team. As recently as Friday, Maryland's State Department of Health and each of the counties were still denying our public information requests, saying release of that information serves no public health purpose and could lead to the identification of patients. Now it seems the governor thinks otherwise. Late Monday afternoon, an about-face as Governor Larry Hogan directs the state to release the names of all Maryland long-term care facilities with COVID-19 outbreaks, including the number of cases and deaths. The detailed information will be provided with the state's daily updates on its website. The new Transparency will give families a way to confirm that they're getting accurate information from their loved one's assisted living or nursing home. William McKell was pushing for that. He says he's tried repeatedly to get information on potential cases where his aunt lives.
I was told that if there was an outbreak, that the state mandate that the facility would abide by would be that the families would be notified. And then after that, they wouldn't provide any additional information.
Earlier this month, the federal government began requiring long-term care facilities to report COVID-19 cases and deaths to residents and their families. Consumer and health policy advocates said that was not enough.
I don't think we can just trust them. I think that the public, again, has a responsibility to track that, and we can't do that, and we can't hold them accountable if we don't have the information.
Now, families in Maryland will have that information, although the state did not say when this week the data would be posted. D.C. was the first in our area to embrace this transparency, releasing a list of facilities about 2 weeks ago. Virginia is still refusing to disclose which facilities have cases and is only releasing the numbers.
Long-term care facilities account for more than 60% of Maryland's COVID-19 deaths. But the News 4i team found many of those deaths have vanished from the state's website, making it look like far fewer homes have had serious outbreaks. Our investigative reporter Jody Fleischer has more tonight on the impact that could have.
We've been keeping track of the outbreaks in Maryland's long-term care facilities since the governor made that list public in late April. It's how we noticed that homes where dozens of people have died and hundreds have become infected have now dropped off of the outbreak list.
It's just unacceptable. It's just unacceptable.
Health consumer advocate Lenny Preston says if Marylanders have to make a quick decision where to place an aging loved one, the state health department website is the only place to see how assisted living and nursing homes have fared with COVID-19.
If you're going to make an informed decision, you don't want somebody else deciding what information you need. You want all of the information.
But the News 4i team found less than half of the facilities with coronavirus outbreaks are on this list. At least 120 facilities where residents and staff have died, more than 1,000 deaths total, have been removed from this website.
It leads me to think, well, there are only 100 sites with a problem. That is not full transparency.
In the fine print, the state explains that facilities are removed from the list when 14 days have passed with no new cases. Never mind if existing residents are still infected or if dozens have died in the past few weeks or months.
I mean, when the little caption says in, very small font, sites get taken off after 14 days, I mean, that's not particularly useful.
Sage Point Senior Living in La Plata, where health inspectors fined the home $380,000 for COVID-related deficiencies, no longer on the list. Potomac Valley Rehab and Healthcare in Rockville, with 144 cases and 32 deaths listed last week, gone from the list this week. Yet Brookdale of Towson, with just one infected staff member, is listed.
It's not a level playing field.
Joe D'Amatos, president of the Health Facilities Association of Maryland, agrees and says he's not aware of any industry leaders requesting that outbreaks be removed.
We won't know how to beat this until we know where we are now. And so, we advocate for transparency and knowledge.
He says there's also a fairness component since these homes compete for customers. Those shopping around might not interpret the numbers correctly.
We're still struggling with it in one respect because we still don't have the context of reporting. Most people can't frame those numbers.
If you ignore the lower numbers in bold print at the top of the web page and instead scroll to the bottom, you can see the state's much higher total numbers. But there's no corresponding list of facilities, cases, and deaths. Once the facility has had deaths, should they ever fall off that list?
Never. Never.
To be clear, there have been some homes where everyone has recovered and the COVID outbreak is over. A health department spokesman said the website is meant to be a point-in-time picture and that if someone new tests positive, the home goes back on the list along with all of its cases and deaths to date.
Nearly 60% of Virginians who have died from COVID-19 were from the state's assisted living and nursing homes. But so far, state leaders have refused to identify which locations have the outbreaks that we should be most concerned about, citing privacy laws. After hearing from many of you about all this, having trouble getting information, the News 4i team launched a massive effort to compile that data ourselves and build a map. Jody Fleischer reports.
For the past month, we've been asking you to help us bring some transparency to the outbreaks in Virginia's long-term care facilities, and you've responded.
Not providing the facts and the transparency actually leads to really a tremendous amount of anxiety for the families.
These three women each lost a parent to COVID-19 at 3 different long-term care facilities.
I don't understand why they're hiding it.
Each felt like they didn't have all the information they needed.
Or at least know what your loved one is facing, then maybe you can help. Maybe you can reach out one last time.
Virginia has refused to publicly release how many residents and staff have tested positive or died from COVID-19 in each of the 162 outbreak locations, citing their privacy. Families have no way to verify if their loved one's home is telling them everything.
I think there is no reason for any family member to be in the dark.
Melissa Andrews runs Leading Age Virginia, which advised its 131 members to be transparent with residents and families. But she also understands why many facilities won't share numbers publicly.
I do think that there is a fear that they are going to be labeled a bad provider.
She says even though a facility has an outbreak, it doesn't mean someone was at fault.
Nursing homes care for people who are really, really sick. They have multiple chronic conditions. And a fairly high percentage of the people in our care have do not resuscitate orders.
Joe D'Amatos is president of the Health Facilities Association of Maryland, where the governor decided to release facility-specific numbers. D.C. has done the same. Both have been included on this NBC Washington map for weeks. Now the I-Team has worked to include at least 113 facilities in Virginia.
We advocate for transparency and knowledge, but you also have to understand context.
For example, some of the data we've posted has come from the facilities themselves, fully transparent. But other early outbreaks were only confirmed by the health department since they were so severe. The state has denied our repeated requests for location names, using Virginia law to consider the facility to be a person, requiring privacy. We've used gray dots to map the locations where you told us about positive cases, but the facility didn't confirm or didn't respond. Andrews says naming the facilities with outbreaks could also keep staff who work in multiple places from spreading the virus.
I wish we weren't having to have this conversation because I wish that all providers were just giving this information out.
We know the numbers are just a snapshot because they're changing daily, but the map can now offer a bit more information for families looking to see which facilities have had positive cases and how much they're communicating with the public, which may help some decide where to place a loved one in the future. The governor touted his decision to release this information late Friday after families and legislators had been calling for transparency for months. But when we took a closer look, we found, particularly here in Northern Virginia, a lot of that data is missing.
I have always said that the more transparency that we have, the better, as long as we protect people's privacy.
The new state website lists all 232 Virginia nursing homes and assisted living facilities that have had outbreaks, accounting for more than 6,600 cases and more than 1,000 deaths. But we found many of the homes in that list are missing the number of cases and/or deaths because the state withheld that information. When we asked, we found out if between 1 and 4 people became infected or died at a location, the state decided not to release the numbers, saying it might identify the patients, which Virginia law prohibits.
There's been no change in the code. This is in response to a lot of misinformation that was coming out of Washington, which was very confusing, and that's why the decision was made.
The I-Team found out of the 77 homes listed in Arlington, Alexandria, Fairfax, Loudoun, and Prince William counties, more than 45% are missing information. Even so, we know Northern Virginia facilities account for nearly half of the long-term care cases and more than half of the deaths. I followed up with the state to ask how releasing the rest of the numbers would identify a specific patient, especially if it's 1 or 2 out of an outbreak of dozens. That has not yet been explained. Jody Fleischer, News 4 I-Team.